transition to our rapid fire. I'll tell
Okay.
you why. Because in our like 20 minutes of conversation, I feel as though we've identified quite a few areas where I think it would benefit our listeners to give them a bit more definitions.
Sure.
If you're open to a rapid fire, that's what the name suggests. I'm going to ask you a series of mostly what, not always what, mostly what questions. And we are looking for you to give us a short answer to the what question. And what we
Sure.
often do with this section is it's part of our main podcast, but we will often clip out individual question and answers because what we've learned from the community is they like these like short definitions of things that a lot of us in I put that in quotes, in the community take for granted. So,
Sure.
ready?
Sure.
Okay. What is low dose CT?
It's kind of like an X-ray that takes pictures of your lungs. The radiation that you're exposed to is a little bit more than what you'd be exposed to in a mammogram. You don't have to take your clothes off. You can just lie in the machine.
All right. You're gonna be so good at this, Belinda. What is CMS?
Center for Medicaid and Medicare Services. So they're the ones that do Medicare, Medicaid, and things like that.
What is PFDD?
Patient-focused drug development. Do you want more of an explanation? So patient-focused drug development has come to be a term that is used in drug regulations to make sure that additional information is being collected directly from the patient about how they feel and to go about their daily lives.
Okay. What is a thoracic oncologist?
That is an oncologist that focuses on the thoracic area of your body. So it includes your lung, but I'm not going to be able to say esophagus, and that region. So they're really chest oriented versus a breast oncologist who's going to focus on breasts.
Okay. What is non-small cell lung cancer?
It is the type of cell. It's a cell level information about your cancer. There is also small cell lung cancer and large cell, and it's when someone takes a biopsy and looks under the microscope to see what kind of cells are growing.
What is adenocarcinoma?
Similar. It's again, we're breaking it down so that we can target treatment more, and it is a type of cell that is growing within the lung cancer and it helps target treatment better.
What is histology?
That's a good question. I am not a biologist, so I do not know the difference exactly between the cells and then the histology.
Totally okay. What is next generation sequencing?
That is a test where if you have a diagnosis of lung cancer, and I'm just going to do a PSA, a public service announcement here, you should get your tumor tested with some sort of next generation sequencing to learn about what types of again, cells, we refer to them as oncogenes, are in the lung cancer to again make your treatment more tailored to the type of lung cancer that you have. Because lung cancer is now not one or two diseases, but it is many, 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 many subtypes. And there are now specific treatments that target not all, but some of those particular types of cells and how they behave in the cancer.
What is the difference between a smoker and someone with tobacco history?
Nothing. It's about using language where we don't call people by their behaviors. And so we don't refer to people as rich or poor often when we're talking about different groups. And at Longevity, we don't refer to people by behaviors either.
Can someone who has never smoked get lung cancer?
Yes.
Can someone living with a smoker or someone with tobacco history get cancer?
Yes.
What is lung cancer screening?
So it is a type of cancer screening where you go to have a conversation with your primary care doctor about whether you would meet the criteria to have it done for you. You can pay for it out of pocket, of course, if you wanted to. That is an option for some people. I'm assuming that would work. But for most people, we're going to go through insurance because those things cost thousands of dollars and it's not available for us. So, and have what the criteria that have been set by these task forces that set who should be screened, and then you can go ahead and get that low-dose CT scan done.
What are the risks for getting lung cancer?
The risks factors for getting lung cancer, including tobacco, secondhand tobacco, radon, which actually comes from the earth, and so it depends on where you live, but then also not only where you live, whether you are, say, in a basement apartment versus on the 10th floor where you work, things like that. Asbestos, which is in building products, and I only learned at longevity that in the US, asbestos until very recently was still allowed to be in building materials. I thought, like many countries globally, that it had been required to not be in building material, like newly. So silica, so if you work with stone and cutting stone and breathing those sorts of things in, that can impact lung cancer. There are a lot of risk factors.
Uh, it's a rabbit hole I have gone down.
It is a rabbit hole.
Don't recommend it, guys. That's why summaries exist.
I have heard patients tell me that they went down the rabbit hole of looking. And I mean, the thing is, the dose makes the poison, right? And that's what we don't really understand well. Like, a little bit of exposure to asbestos or radon is not probably going to give anybody, like, lead to a diagnosis of lung cancer, but it's how do those all combine in your family history, and then, that's how you get a diagnosis.
Why should people who have a tobacco history get tested or screened for lung cancer?
I mean, I understand that there is shame and guilt. I have talked to people who told me, well, I knew this was a product that causes lung cancer, so, it was my fault. But tobacco companies made very deliberately a very addictive product, and that leads to lung cancer, among other things as well, not just lung cancer, but other chronic comorbid conditions. And so I feel like you should have a conversation at least with your doctor, because if it is caught earlier, the treatment situation you'll find yourself in will be an easier path than if it becomes metastatic. And it is not it's a really sort of difficult diagnosis when it's advanced. Like, the reason my mother-in-law got diagnosed was because she had fluid on her lungs and felt like she was drowning. It's a very unpleasant situation to have diagnosed, and she was diagnosed quite late stage. It had metastasized into a few different organs, and so nobody wants to find themselves there. It's much better to get screened and find it earlier. And while, any diagnosis of cancer, whenever it happens to be in the staging, is terrifying, it is still just easier when it's earlier.
Now, what percent of individuals with tobacco use end up getting lung cancer? Do we know?
That's a good question. I think it might be about 20%, but don't quote me on that. I'm not 100% sure. It's not, I mean, I feel like we pushed the narrative as a society that there is a direct, very strong correlation between smoking cigarettes and getting lung cancer to try to stop people from smoking as many cigarettes. It's backfired. I think it's backfired a little bit in that it has added so many layers now of stigma and shame that people don't feel comfortable telling their physician about their tobacco history and use. Like, I think a lot of people just would rather sweep it under the rug and feel like it's their individual problem, and that they know it's bad. They don't need someone else necessarily telling them that it's a bad thing to do.
Have you found to be the most common myths surrounding lung cancer?
That I think that just the idea that that it's an older people's only, like, it's exclusively diagnosed in older adults, and that is not true. I mean, while the average age is 70, 71-ish, so indeed it is more common. I've met people in their mid-20s who have been diagnosed with lung cancer, so you can get a diagnosis in your 20s of lung cancer. And then just all the factors that influence, like, I don't think people understand how many exposures there are that can lead to a diagnosis of lung cancer. And as we face global climate change, whatever you want to call it, this is going to be an issue for all of us, right? As we breathe in more polluted air, what's that going to do for our lung health? Like, that is critical. What is vaping going to do for our lung health? Like, these are unknown questions right now, but I don't imagine it's anything good.
What is the most memorable piece of advice you've heard from a lung cancer patient?
Most memorable piece of advice. It's not so much advice, but it's really sometimes watching where there's two people who've been diagnosed and one more recently and one who's been living with lung cancer for 10 years. And just the hope that someone who's been recently diagnosed meeting someone who's been living with lung cancer for 10 years, like just the look that it comes up, like that comes over them, it is really amazing to see and watch when you connect people like that, because I think, if you just look at the statistics, they don't look good. But there are folks in our community who have been living with this diagnosis for a long time, like 20 years even. So, that always sort of makes me very happy to see those connections being made with people.
What is a citizen scientist?
So this is a term that gets used for a number of different projects where you invite members of the community to participate in science-based activities. And so for our lung cancer citizen science program, the membership of being a citizen is being in the lung cancer community, then being interested in getting hands-on research experience. So not being a participant, that's different. Filling in a survey, joining a focus group, that's not what we're defining citizen science as. That's, more as participating in research. The citizen scientists are really behaving as a scientist would by having conversations about what is the research question, what's the design of the study, what are some of the factors we're going to have to consider as we sort of roll this out for implementation. And
What is longevity?
it is a nonprofit that's focused on lung cancer, and we are at the national level. So we provide services for the community across a number of different pathways. So we do have patient services that do mentoring. We have social worker, nurse who can help people navigate very specific issues. But we also have a policy team that work on policy related issues. So whether that be something that the FDA is planning to do, or as I said, Centers for Medicaid and Medicare Services, we have folks who work on issues around specific to those sorts of things. We also have a group that work on screening initiatives to try and create, again, more materials, especially for those who are in communities where it might be challenging to access these services. And so it's a rather large group of people who work basically to improve outcomes for people living with lung cancer.
All right, my final question for you is, what is your favorite chocolate?
That's an incredibly difficult question to answer. That might be the most difficult because that one will depend on my mood, because like all humans, I'm inconsistent too. But right now, maybe it is dark chocolate with caramel.
Ooh, that sounds amazing. I'm hungry now. Belinda, thank you for taking the time. I already know our community well enough to know that the rapid fire section of this episode is going to do very, very well and be very appreciated, because you've really taken a very complex subject and demystified it and given us clarity in areas that are hard. They're hard topics. So